More on the situation in New York, where nearly 300 people have died from COVID-19, with one doctor saying 9/11 was nothing compared to this. Joining us is former Associate Commissioner at the Food and Drug Administration and President of the Centre of Medicine in Public Interest, Peter Pitts, who is in lockdown himself. Hello to you, Mr. Pitts. Thank you for joining us and for staying up so early, so late for us. What's it like there at the moment?
Well, we're sheltering in place and keeping our social distance. So in many respects, it's like, I guess, visiting my wife's parents over Christmas. But it's our new normal. We're learning that to battle COVID, it really takes a community. It's a community effort, and I'm feeling a bit of a post 9/11 vibe that we're really beginning to pull together and recognize that the way to beat this, beyond medical measures, which are clearly making tremendous progress, is to solve it as a community. So that's a little bit of good news, I suppose.
Why do you think that New York is the epicenter for the United States?
Well, New York is the epicenter of the United States for so many things, but I think the answer relative to COVID is that we're a nexus of travel, we're a nexus of business. There are a lot of people here. It's all the variables that, when they come together, make it the perfect storm of a viral center.
Okay, we heard from Governor Cuomo yesterday, and he's saying that New York State is short by 30,000 ventilators. How are you going to get those? Who's going to help you?
Well, the governor is doing the responsible thing by focusing on the worst case scenario, which I don't think is going to happen. But the way that we're going to get more ventilators and more masks and more gowns and all the things that we need to combat COVID, hospital beds certainly, is to get to it. I think one of the lessons that we did not learn, none of us learned either in the States or in Europe or anywhere from China, was to be prepared from a industrial management perspective. We need to get the materials from where they are to where they're needed. And we're starting to get that done, and we will get it done. But we got a late start, and that's a lesson to be learned for the next time, because unfortunately, I'm sure that there will be a next time.
You're talking about worst case scenario there. The president is the flip side of that, isn't he? He says, we can't let the cure be worse than the problem. And he thinks that America will be back on its feet by Easter, which is the 12th of April.
I think the president is trying to be our optimist in chief, and I certainly respect that. I think clearly, Easter Passover timeframe is a bit too optimistic. I don't really believe that's going to happen. But the president did say, I guess to his credit, that he was going to follow the advice of his science advisors, and that's a shift. I think that what America wants and what we're getting now is solid advice from healthcare experts rather than politicians, and I would suspect that in Britain that will be the dialectic as well.
We've had a real problem here in the United Kingdom convincing people that they need to stay at home, to the extent where we've had to enforce a lockdown, basically. It's fair to say, I think, that Americans are equally headstrong. How are Americans, your fellow Americans, responding to this?
Well, I think once we recognized that this actually is a crisis, we all pulled together. I mean, getting people, certainly in New York, off the streets, out of the restaurants, out of movie theaters, away from clustering in parks and public places. That's something that would never happen before. You'd think it would be impossible, but we did it. We did it relatively quickly. And when you walk on the streets now, for example, to walk your dog or go to buy food, it's kind of eerie. It's almost as though you're walking on a Hollywood movie set of New York rather than a robust, vibrant city. And you can sense that people really want to solve it. They want to get it done quickly so we can all get back to life as normal.
Okay. And are you well, Mr. Pitts?
Very well so far, as is my family. We're wearing masks outside just to be double safe. We're trying to take care of our friends who are ill virtually. I think the hardest thing for Americans, and probably for everybody, is to stay away from older people and to keep young people away from older people. That's a lot harder than it sounds, but it's absolutely crucial, for the most at-risk populations.
Look after yourself and your family. We appreciate you taking the time and staying up for us. Thank you.
Thanks.
Meantime, 4 British women travel